For the first question, it asks, how do you handle a situation where a patient becomes verbally aggressive or threatening? And in my psychiatric nursing position that I am interviewing for, in these situations, I would take the necessary precautions in order to calm the patient down. Throughout my training, throughout my degree, and the training I get within these next 2 years of college, I will be able to note what those procedures are and move accordingly. I would also make sure that I stay patient and I stay calm within the situation to ensure that things go as smoothly as possible. The second question is, describe your experience working with patients who may have a reoccurring mental health disorder. And for this question, I would obviously look at their chart, see the history that they have within the facility, and then I would go from there. I would make sure that I'm taking the right precautions in order to treat each patient the way that they need to be treated and have efficient help in a timely manner as well. How do I assist a high-risk suicide patient, and what steps do I take if I identify high risk? Okay, so first of all, I would again take the right procedures in order to deal with a high-risk suicide patient, making sure that I am trying to obviously calm them down. I also will make sure that there is nothing harmful around them that could hurt them. Maybe sit and have a conversation with them, try to see what they're thinking, how they're feeling, and try to be that one-on-one emotional help and not always seem or come off as the doctor or the nurse. The steps that I would take if I identify something as high risk, I would make sure I go tell a supervisor, go report it correctly, making a report, putting it on file, and then getting that patient the help that they need. My fourth question would be, how do I build trust with patients who are initially resistant to treatment? Again, like I said, a major thing for me, I do feel as though making sure that they're being heard on their side, also making sure that things are not always seeming like something's wrong with you, because making them feel comfortable about their disorder, because disorders are not a bad thing. They are just things that we are noticing and we're treating for. It's just as anything like a cold or flu. So making sure that your patient understands that they're not crazy, you know what I'm saying? Like, not using any of those verbiages, or like they are not normal because they have a disorder. Making sure that they also have that one-on-one care again as well. And then the last question would be, how would I operate with telling a coworker that I may need help, or reporting that I'm being bothered or anything of that sort? First things first, I would obviously remain calm. That is the main thing that you need to do in these situations in order for things to go as smoothly as they possibly can. I would also make sure that I am reaching out to my supervisors, my managers, trying to handle it if I feel as though I cannot handle it myself or come to a good solution on my own. I would make sure I report it and go about it the right way. And then with patients as well, just making sure that I'm following all the guidelines and the rules and just communicating, because without communication, things can't be effective. Thank you for listening to my interview. I appreciate it.